Your city, your stories. Celebrating the people and places that make Houston shine. It's Great Day Houston. And now, here's your host, Deborah Duncan.
Good morning, everyone, and welcome to Great Day Houston. All right, so when you go home for the holidays, a lot of you might look through old family photos and ask yourself, just when did the extra chin settle in? And when did gravity get the best of your chest? Just like tech, plastic surgery is always evolving to get better, more natural results, sometimes with little or no downtime. Joining us with the latest procedures to freshen the face and boost the breast, among other things, is Dr. Mentz with the Aesthetic Center for Plastic Surgery. He is the country's first triple board certified plastic surgeon and is constantly looking for the latest and most effective ways to get your desired results. Good morning.
Good morning, Deborah. Thank you so much for having me.
Listen, I told you in the green room, there's an assignment that I have given you and your entire team. The minute you see me going south, you are to call immediately, and I will be in surgery by noon, okay? But Dr. Mentz, you have been a plastic surgeon for 30 plus years. When I said triple board certified, what does that mean?
Well, you know, in training, the goal is to achieve board certification, and I wasn't married. I was very interested in medicine and head and neck surgery, ENT, facial plastic surgery.
Yeah, we said he wasn't married. That means he had a lot of time on his hands.
Yeah. Exactly. Yeah. So I just stayed going, and I really loved learning and stayed with it, and so I became the first triple boarded in the country. Wow. There's several more now, but it was a lot of fun doing it, and I really appreciate the guys who taught me.
Yeah, but it's important to look at being board certified.
Yes, definitely. Board certification is a rubber stamp that everyone should look for when they're looking for a plastic surgeon. There are other people that get into it, but they don't have the training that is really the bedrock of what we do.
Yeah, you were voted America's best plastic surgeon by Newsweek in facelift, rhinoplasty, eyelid lift, breast augmentation, and liposuction, several categories there. All right, as I mentioned, it's always evolving. There's this thing called the Texas Jawline. What is that?
Well, in Texas, you know, women are elegant and they're strong, and they love a strong jawline. Mm-hmm. And what's happened through the last 10 years or so is neck lifts have become much more powerful. You've heard of the deep layer facelift. Yeah. This is basically a deep layer neck lift, and we're doing more structural.
Well, it's almost like we can kind of custom order some things, because it's like a full facelift used to be people will go in and go, just get a full facelift. Right. But not everything on the face needed to be lifted, right?
Well, that's right, and most people do come in for neck more than face.
Yeah, it's the first thing to go.
It's the first thing to go. And so I've incorporated this internal bra that we use with breast lifts. It's this material right here.
Okay.
It dissolves in about 4 to 6 months or so and leaves a lacy sort of internal bra to help support the neck.
Yeah, so you don't see it, but just gives support.
Right, and neck lifts last a whole lot longer using this material. It's soft and it dissolves and it's safe. It works beautifully.
Yeah, all right. There's a non-surgical jawline that you can do, and sometimes you can do things like that with fillers and all, so people can get an idea of what it's going to look like, right?
Right, and lots of people begin with that. A little bit of filler in the chin, sometimes in the jawline. Sometimes we use Cool Sculpt in the neck to shrink it some, but in the end, you know,
it's not permanent.
Time wins.
Yeah.
And that's why surgery is really the most valuable component to the creation of a beautiful and elegant jawline.
Yeah. Okay. What's the process of that, and who would need that?
Really, I see patients as young as like 38, you know, kind of in there.
And sometimes it's just genetics, right?
It is genetic. Yeah. You can look at your mom and you can tell where you're going.
Oh. All right. So we just have some pictures here of just showing that. The youth that it brings with just that, that lifted neck and that tighter jawline, as you mentioned. All right. You want to say something?
I was to say the first one had a heavier neck, mm-hmm. and that we made a little bit leaner. The second one was a beautiful, elegant young lady that we gave her a little bit more crisp jawline, and you can see this patient has a little bit more softness and some age. But all those patients we can improve, and everyone's after that Hollywood neck.
Yeah, you know? Yeah. And not every person is the same. You literally take time to look at, just little tweaks for each person depending on what their features are.
And that's the beauty of it. Every surgery we do, we can tailor, and that's what makes it fun.
Yeah, all right, breast implants. First I want to clear up some myths, and now I want to talk about this new implant that's out. And one of the myths is you can't get an accurate mammogram.
The mammograms are 5% less accurate because the implant, I'll hold up an implant, when you take an x-ray, it can't see through the implant.
Right.
So they go north and south, they go east and west, and when you have an implant, they actually go east-west.
Right.
And so they capture almost all of the breast tissue with the exception of 5%. But the data shows that patients with breast implants don't have a higher incidence of late detection.
Yeah.
So the detection is the same if you have an implant. They figured it out.
Okay, and then you can't breastfeed. Well, you can.
You can.
Because I did.
Yes. 5% can't, but I think that's because of nipple sensitivity and those things,
Yeah.
just like normal.
Yeah, and in terms of being safety, it is the most common plastic surgery. And you know, it's not all about size. It's really kind of about proportion for a lot of people.
Yes, and this new implant is really creating another venue for breast enhancement. I'll show you the old implant.
Okay.
Is a saline implant, kind of sloshy.
Right, okay.
That came in 1991. These implants, you know, I trained under Tom Cronin, who invented this implant. This is a silicone implant, and the newest implant is far safer and much more long-lasting.
The Motiva?
Motiva.
Okay.
It is a great implant, and this implant is really going to change what we do, and it allows us to utilize a smaller, more delicate implant to create sort of that ballerina body or that Pilates body. It's a perfect implant for those patients who had a perfect breast at age 18, 20.
Yeah, who didn't?
And,
Yeah.
and now they're 27, had 2 babies, and they have a little upper pole scalloping, and you can put in a small implant to recreate and preserve the breast.
Yeah, that fullness
Yeah, it works
there.
beautifully.
Yeah, other breast surgeries that you do, obviously, you know, gravity sometimes takes over.
Yeah.
You do breast lifts and also reductions, because there are sometimes when it's really a health hazard for a lot of women, and just the, you know, the neck aches, the back aches and all stuff, because it's just so heavy.
That's true. So we're doing breast lifts, really in that mommy makeover bit, you know, with tummy tucks often. We're doing breast reductions, really for comfort, and also it makes patients look heavy.
Yeah.
And so many patients really are after a much more athletic physique.
Yeah.
And so even patients with sort of a kind of old school sort of full D that used to be pretty good in the 60s and 70s, they really want a more athletic contour. And so
Yeah.
we're doing reductions on patients that actually have medium to large breasts in order to get them to a B cup.
Yeah, yeah. You just want to, it helps your clothes fit better as well.
Right.
Okay, other procedures you do, as you mentioned, being triple board certified, you got to take advantage of that.
Yeah.
Rhinoplasty, which means the nose jobs, brow lift, you know, the eyelids. Sometimes when they droop, it can make somebody look older.
Yes.
There's the autoplasty, ear surgery.
Yes, some patients are born with a prominent ear.
Yeah.
You know, and it seems like all kids are born with prominent ears, but then their heads get bigger.
Yeah,
So,
to fit. Yeah, yeah.
yeah. But at age 7, you know, when the kids are starting to make fun of them,
Yeah.
you know, they get the Dumbo ears and that kind of thing, that's a good time to make a change up. And those kids are done at Texas Children's, and they treat those kids well. But I do see adults that come in for facelifts and rhinoplasties that have a prominent ear or 2 prominent ears, and you can tuck the ear back.
Yeah.
It works well.
Yeah, one of my friends even came in for this. It's kind of minor, but it really bugged her. She had pierced ears for a long time. She couldn't wear her earrings because the hole was so big and it was drooping all the way down.
Yeah.
You stitched it up for her, and now that's what we give her for her birthday and Christmas. She's getting earrings again.
Yeah.
All right, the tummy tuck, you know, and lipo, the combination thing, and even men who've come in to get some liposuction, and I saw one guy who you etched him a 6-pack.
That's right. You know, I invented that 6-pack operation back in 1992. It was a liposuction sort of twist, and it's become extremely popular. So we etch in the contour of the 6-pack. So guys who are working out, they're doing well, and sometimes the muscle just doesn't show.
Yeah.
The cheat is we can liposuction the grooves and give them a 6-pack that they never had. It works extremely well, and I've got patients now that are 30 years out, so the longevity of the operation is quite good. And it's a refreshing operation. Guys are happier taking their shirts off. And
Yeah, he won't put a shirt on. It's really, yeah, he shows up all kind of places with that shirt off. All right, and then a lot of people, you know, have time off around the holiday season, so this is time that they like to get in, or during spring breaks and stuff like that. But with time management, there are several things that you can combine all at the same time.
Right, combination surgeries are very popular, and the mommy maker was probably the most popular, where we do breast lifts and tummy tucks. And tummy tucks now we do with no drain. We do a little bit more athletic contouring. We make the operation more comfortable because we're using a long-acting local anesthetic. So that's an easy one to combine in there. And then with facelifting, a lot of times we're doing arms and breasts with that as well, because most of those patients or 50-ish, 60-ish, and they have some other stuff.
Well, 60 is the new 40. All right, Dr. Mentz, thank you very much, and remember your assignment when you see
Deborah,
stuff
thank
going
you
south.
so much.
All right, Dr. Mentz has a special offer. Enjoy a complimentary consultation for first-time breast augmentation patients considering Motiva implants. To book your consultation, give them a call at this number, 713-799-9999. Again, that number is 713-799-9999, or visit his website at drmentz.com. You can also follow him on Instagram at dr.mentz.